Hello, welcome back to my channel. Don't forget to subscribe, watch, like and share my videos. Today I'll be talking about cramps, menstrual cramps. Cramps are painful tightening of the muscles during periods. Cramps happens when the uterus contracts to shed its lining. Cramps are mainly caused by high level of chemicals called prostaglandins. Prostaglandins, these chemicals makes the uterus contract strongly during menstruation. We have two types of cramps. We have the primary cramps, primary dysmenorrhea. We have the secondary cramps, also known as secondary dysmenorrhea. Primary cramps are common menstrual cramps not caused by any underlying medical conditions or diseases. They usually begins a few years after period starts and may improve with age or after childbirth. Alright, there are common and not really severe secondary dysmenorrhea are caused by people that experience heavy menstrual flow, stress during menstruation, or families that experience painful menstruation. Alright, but secondary cramps are caused by some medical conditions affecting the reproductive organs. They are often more severe compared to the primary dysmenorrhea, and it begins after or later in life. Initially, you're not having these pains, but due to some reproductive conditions affecting your reproductive organs, you start having severe menstrual cramps during your periods. Alright, conditions like endometriosis. This is when the tissues similar to the uterine lining grows outside the uterus. Tissues similar to the uterine lining growing outside the uterus might cause severe menstrual cramps. We have the uterine fibroids. These are some strange growth that occurs in the uterus. Strange growth happening in your uterus. Alright, and we have pelvic inflammatory diseases. Inflammation of the pelvic region might also cause severe menstrual cramps in secondary dysmenorrhea. Alright, so some common symptoms of painful periods, painful dysmenorrhea. Alright, some common symptoms like fever. Some people might experience nausea and vomiting. Some may experience intense tiredness. Alright, painful periods that affect your normal life activities. Alright, so we have management, but management of dysmenorrhea depends on the course of the cramps. If it's a primary dysmenorrhea, we could manage it with non-steroidal anti-inflammatory drugs like ibuprofen. But in the secondary dysmenorrhea, the pain may be so severe that some might prevent it or control it with some hormonal medications like birth control pills or injections, and in some severe cases surgery might be recommended, alright, such as large fibroids and severe endometriosis. Alright, so seek medical care if the pain is severe, bleeding is very heavy, cramps suddenly become worse, pain continues even after the menstruation. Alright, don't overlook any cramps that worsen even after your period. Alright, pelvic pain that happens even after your menstruation, it could be due to pelvic inflammatory diseases. It could be due to endometriosis. It could be due to fibroids. So please, don't say it's just a common cramp. If the cramp is severe, if the bleeding is intense, to the level you start feeling dizzy and cannot carry out your daily activities, alright, we can manage some mild the primary cramps with a warm bath. You take enough fluid, you stay hydrated, alright, or a heating pad. You use a heating pad and massage it around your pelvic region. Alright, don't overlook any cramp that lasts more than your period flowing days. Seek medical interaction. Seek medical care if the pain is severe. Thank you, and cheers to every woman out there fighting menstrual cramps. Thank you so much. You are queens. You are strong. Alright? But please seek medical help if the pain is more than what you can bear. Because some menstrual cramps can't really go away with painkillers. So if the pain is so severe that interacts with your daily activities, interrupt with your sleep, please seek medical help. Thank you so much. I'll see you in my next video.